We're taking this, 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 we're taking with a pinch of salt.
Hello, ladies and gentlemen, and welcome to another podcast of A Pinch of Salt. My name is Andrej Kubernet, and today we're going to be talking about the nurse's perspective, the nurse's view of nephrology. As you all know, we physicians and nurses do not always have the same view on the patient, and in my experience, I would say that most of the time the nurse's view is the more realistic one, or the one that is closer to the heart of the patient. So I'm very happy that we have the chance to talk about this with Jeanette Finderup, who's a clinical nurse specialist at the Department of Renal Medicine at Aarhus University Hospital, and has been in the field quite some time, has a lot of experience with nephrology patients. So Jeanette, welcome to A Pinch of Salt.
Thank you so much.
So maybe I thought we'd just start with a general question, which is, why do you think being a nurse in nephrology is a great career choice? What do you like about working in nephrology?
I think one thing is that it's a complex condition affecting a lot of body function, so you need to use your brain, but it's also instrumental. You have to do hemodialysis or peritoneal dialysis, so you also need to use your hands. But it's people with a long time condition, so you also need to use your heart. So it's the whole of you use in nephrology, taking care of these type of patient.
That is so true, yeah. These long-standing relationships with dialysis patients are challenging but can be beautiful at the same time, right?
Yes. So, of course, it's not just a patient population I like, but it's all the people with chronic kidney disease I have met during my long time in nephrology, and it's real people living with this condition, doing a lot of treatment, have a huge treatment burden, but they managed that. That's a very important thing for me to like being in nephrology, and also all the informal caregiver, how they support the people with chronic kidney disease. But then I also think nephrology attract a lot of good staff, so there's a lot of nice nurses and nephrologists and other healthcare professionals taking care of these patients.
It's amazing, because I have exactly the same experience. I think there's something about nephrology in every country that attracts a certain kind of person, I believe.
Yeah, because we are really keen about these our patient or the people with this condition. So we want to do just a little bit extra for our patient, and I think that's also make we are kindred spirit or something like that.
True. So what do you think is the most difficult part of being a nurse in nephrology? Where do you see possible deficiencies in nursing practices that we're either not aware of or not good at correcting?
I think that we have learned from the past and in our education that we need to take care of the patient. And working in nephrology with a person with a chronic condition, that's not the most important part. It's to care with the patient. So to involve the patient in the decision making and involve them in their treatment and their health, I think that's very important. And although our patient population is a lot at the hospital, maybe the patient group most at the hospital at all compared to other patient group, because they have this huge treatment burden. Still, they have much more time at home taking care of their condition. And I think we just said, you need to do this, and then they go home and they do something totally different. So we need to involve the patient in the decision making, so we make the right choices together with the patient and the informal caregiver, but also, if it's possible, support their self-management so they're able to manage their condition and the treatment on their own. I think that's, and it's a focus in my clinical area, and it's also a focus in my research view, how could we enhance patient involvement. And a part of that, and I think that's very overlooked in our area is to take care of the uremic symptoms. It's difficult to deal with, and it's difficult for the patient to deal with, but I think we have overlooked this area and is not are not focusing not enough on this area.
Yeah, I have the same kind of instinct, the same kind of feeling, and I believe as a doctor, as a physician, I believe a part of the important part of nursing is that you notice usually so much more than we do, because you basically just spend more time with the patients and you notice things, you gain more information about them. And I think one of the most important things is that you can work with your doctor, your physician, to explain what is actually going on, because we're not always completely aware of these issues. So that's become, I think, very important. So a good and honest, fruitful collaboration between physicians and nurses is definitely essential for good health care. And we all know that we had an old paternalistic model of physicians being above and nurses being below, and that this is now obviously very outdated. But you can still feel these echoes and reverberations that are present. So how do you think we can tackle this or break this? What do you think are some great effective ways to get rid of these barriers that I believe still somehow exist between us?
Yeah, from a nurse perspective, I think the only thing I can do is I can do something for my own. Like I'm the only one to take action.
You can only influence what you're doing.
Yes,
yeah.
That's true. So I can't tell what you need to do, but what I think we should do as nurses is to be proud to be a nurse and be clear about our role, and to be clear about our role as nurse, what we contribute to the patient pathway. I think we need to be clear about that, and to do that we need to be educated, we need to do research, and we need to take leadership also in nephrology. It's not just make the physician to be the one doing research, to be the one being educated. We also need to be well educated to have an independent role in the patient pathway, and then become a nurse who is proud to be a nurse. Exactly,
because we need to be equal partners in this thing. And what you described is an important part of feeling like you're an equal partner, yeah. Which is feelings are important in the everyday life. And so the other thing I wanted to ask is you also observe the way we interact with patients a lot. And I know I'm putting you in a difficult spot because it's difficult to critique someone else, but I just wanted to ask you just well-meaning advice of what you think we generally are not good at in our physician-patient interactions. What are we missing a lot of the time? What are we not addressing? How can we as physicians be better carers of our patients?
Yeah, first of all, I think you should still be physician and are not nurses. So you should not become a nurse. I think we should work together, collaborative, have our separate roles in the patient pathway. Yeah. That's the way through. But still, I think some of the issue I mentioned about the nurses, I also think you could learn from that, like listen more to the patient and not just be the talker, like involve the patient in the decision making, because you make a lot of decision on behalf of the patient, and that's okay. There's a lot of decision to be made, which you do not need to involve the patient in all decision making, but there's a lot of decision where you really need to involve the patient. For example, about dialysis choice, about the old frail patient, should they be on conservative treatment or not on dialysis, and also all the decision which we need to make in the end of the patient's life about end-of-life care. I think it's important that we beforehand have a conversation with the patient and the informal caregiver, discussion, make decision which is based on the patient preference. So that's one part about involving the patient in decisions, but also like involve them in the treatment. So it's not just that you say, you look at the blood test, you need to take this and this medication, and then it's just about compliance and the patient go home and they do not
obedience,
and they don't take the medication.
Yeah.
Maybe they do not have the money to take it, or they think it will harm them. So you need to have a conversation. So it's more like, and the treatment have to be in concordance with the patient's preference, so they don't experience too many side effects, so it impact their life quality of life. So I think patient involvement is also not just for nurses, it's also for the physicians. And also I think just not look at the blood test, but also talking to the patient, but maybe also based on information from the nurse collected together with the patients, but to dig deeper into the symptoms. So when you start a treatment, it's not just based on the blood test, but also on the symptoms of the patient.
That is so true. Yeah. I really liked how you pointed out that we have separate roles and that we should stick to them, because I think this is a very powerful tool, if I can use that word, because when the patient hears the same kind of information from a doctor and from a nurse, it becomes much more, I would say, credible, much more, they believe in it more, because two separate people from different areas have said the same thing. And informed consent or involved decision-making it's a bit of a tricky concept, because we, as physicians, I believe, we're so used to the patient saying, well, whatever you think is best, which is a logical response, because we have been training for so long just to figure out what is probably the best thing for this particular patient. But that doesn't mean that you don't involve them, even if they do tend to say yes to what we're going to do or what we want to do, because if they understand what's going on, it will be completely different, I think.
If it was just about survival, so that was the only important thing in a decision, it was about survival, then you would maybe be the one to say that. But it's also like a balance between survival and quality of life, and you can't tell what is quality of life. Mm-hmm. So I think, and I also experience a lot of patients say, I can't make that decision, you is the one to make that decision. But then in the end, we can't make the right decision if we don't know the patient preference. So, and shared decision making is not that the patient have to make the decision on their own. Mm-hmm. We have to do it as a shared process. Mm-hmm. And so I think it's also about engaging the patient in the decision making process. And maybe that could be a way forward, that you use the nurses to have engaged the patient in the decision making process. So like provide decision coaching, so helping the patient to understand what are the preference, and it's specific if it's these huge decision making, the choices about dialysis modality or stuff like that, that I think it's very important to engage the patient in that decision making process, and I think sometimes the nurses maybe through their education they have better communication skills or are more used to communicate with the patient on the patient level.
That's true, yes. Sometimes it feels like we lack the words sometimes to say things, because we cover such a wide variety of patients. We're basically trained to more or less to take care of younger patients, and we maybe find it easier to deal with that, but then there's this whole geriatric perspective where we haven't really been trained that much to do that, and it's a completely different thing. So we need to think about these things and try to adapt ourselves to the situation. I believe we do that mostly, but...
And sometimes you need to be aware of that. Maybe you as a physician say, you need to take this pill, but there's a lot of things to consider taking these pills, or you just say to the patient, you need to lower your phosphate level, but how to translate that into a patient life, a everyday life, then you need maybe a nurse or dietitian to help the patient manage this issue at home.
Certainly.
So, and the self-management support, I think the nurses also have a great role in that.
I've heard this from many patients who've been long-standing dialysis patients. We just had a discussion yesterday at our Congress with a gentleman who has been on dialysis for 47 years. And basically, I believe they all say the same thing. The best chances of your survival on dialysis and having a good life on dialysis is to be as engaged as possible. So that's something they consistently talk about. And also, I believe that just the basic things like explaining why you're taking these medications, because, with CKD medication, for example, people take them and they don't feel anything. It's not like rheumatoid arthritis where the pain is gone. So I often try to warn them of this. You're not taking this to feel better. Nothing is going to change in the short run. You're just taking this to have a better life later on. It's basically like an investment,
And also when they experience the side effects, I think we need also to educate them about the side effect and how to prevent the side effect or how to alleviate the side effects. So that's also a part of the medication.
So you mentioned conservative care.
Yes.
How much are you involved in conservative care? How
Clinic,
is that running?
So I have done research in that area, and that's one of my clinical parts. So if a patient is old, frail, and with comorbidity, they are referred to me, and I have a conversation with them and their family. Typically, is half of the patient have one conversation, and half the patient have two conversations, and it's typical 1 hour, both conversation, and where we discuss the different advantages and disadvantages for each, for dialysis and conservative treatment, and also pointing out that this is not palliative care, it's not end-of-life care, it's an active treatment, but also that there is a difference in survival, but that we do not have the right evidence about it, but also to investigate what is quality of life in this patient life, not what it was 5 years ago, because it's in the condition or the situation where they are now. So talk about what is quality of life with this condition, with this comorbidity, this frailty, and how does that suit different dialysis modality, or maybe they should aim for conservative kidney management.
Yeah, I've always found that I believe that education about dialysis modality and these things that really impact the normal daily life is actually better done by a nurse, because you seem to be closer to their everyday issues and perspectives, and you're, I think, better equipped to talk about that. So I think it's a good idea to at least involve, if not base. Obviously, we talk about these issues with patients as well, but to have a nurse as well to talk about that, I think that's very useful and very valuable. And in that, you want to say
so
something?
The intervention we have developed in Denmark about shared decision making and dialysis choice, and shared decision making and choosing treatment. None of them, like, we can't tell if it has to be done by a nurse or a physician or in combination. So it's done different in different departments in Denmark. So I can't tell if it's better if it's a nurse or a physician, but it could be done in all three ways.
Yeah.
We don't know.
Well, better or not better, it's certainly another perspective, and an important one. I guess, of course, ideally both of them speak to the patient about that, of course, because we do have our perspective, which is also important, but it's certainly another very valuable perspective. And in that context, what do you believe are the biggest challenges our patients are dealing with on a regular basis? What are their biggest and most important problems? Let's talk about, let's say, dialysis patients who are
I think
specific.
Not just dialysis patients, I think the whole patient population, and it's not just something I believe, but there were a paper some years ago, it was about living well with kidney disease, and it was data from more than 9,000 patients, informal caregiver and health professional, and for more than 70 countries. And the main challenge to live well with kidney disease, it was to address the symptoms and their life impacts. So I really believe that that's the huge challenge we have, to address symptoms and life impacts, and it's both for patient on dialysis and the patient before dialysis, and also, and it's not just to address the symptoms, but also to address the treatment symptoms or the side effects of treatment, we have to address and go further into that paper. They say to do that, you need to, like they have the 3E. So it's about education, just as you mentioned. It's about empower the patient, and it's about engaging the patient. So that's what we have to focus on in the future.
So if the symptoms are, let's say, perhaps the most important aspect from the point of view of the patient, so what are the usual symptoms that you deal with most, and how do you deal with them? If you can answer that in a short way, or I know it's probably not possible. But
the most difficult symptoms to deal with, or the most prevalent symptoms, is fatigue, and it's very difficult to deal with. Of course, you can do do something with the anemia, the nutritional status. So there's a lot of clinical things, strategies you can do, but it's also about energy conservation that they learn to be active, but also be have extra rest to deal with this issue, because it's not something we just are able to deal with. But I did a study with some colleagues 2 years ago at RCT in a dialysis unit where we used music for the patient, where we were able to see a significant difference in fatigue. Where we had people coming and providing concerts once a week for 6 weeks, and that changed the fatigue. So that's really a place where we need to focus more about how we can alleviate fatigue, because I am not sure it's just finding a new medication. So we also need to look into non-pharmacological interventions.
When you said the activity part is important and the resting part is also important, that reminds me of professional athletes, because they have figured out that resting is also important. I follow professional cycling a bit, and I've heard that in the case of Slovenia, what they noticed was that their cyclists had their best results after a period of resting because of an injury, for example, and then after that they were at their best.
Yeah.
So
I have been a national athlete myself, and I work with people being competing at the international level, and that's true. When you make a good training plan for an athlete, the last 14 days before a world championship or European championship, you really have to rest. That's not the time when you do the most training.
Yeah, so it's how you're active and how you rest. Well, that's great perspectives, great information. So if we go towards the end and we try to make a conclusion of this, as a nurse working in nephrology, if you had only one message to convey to us nephrologists, what would that be? And perhaps if you have only one message to convey to nurses in nephrology, what would that be as well?
I think the message would be the same. You need to understand what is the role of nurses and contribute as a nurse. And to do that, you need education, you need nurses who are educated, you need nurses who do research, you need nurses who take leadership and showing the way of kidney care. Yeah.
That's brilliant, absolutely. Now, the final question is sometimes the most difficult one. I hope it won't be. But it's a personal question. It's a getting to know type of question. But the answers are always very insightful and nice. So we're going to ask you the same question we ask everybody. So which book, 2 songs, and luxury item would you take to a desert island?
That's a very difficult question, because I read more books than listen to music. But so it's very difficult for me to pick one book. But a book I read both professional and in private, and I really like and I have on my shelf, because most book I read online, is The Notes of Nursing. It's written a lot of years ago. It was the first professional nurse, Florence Nightingale. She worked in the Crimean War, and she provided care, professional care. She investigate what is professional nursing care, and she were the manager of the whole department. So she was the one to optimize care, and she had written about that in Notes of Nursing.
That's the foundation.
Yes.
Yeah.
And songs, because I like a lot of Danish songs, but nobody knows them.
Oh, it doesn't matter. It can be Danish songs.
So a song I really like is The Shotgun, Josh Ezra. And that's a lot of words. So when I hear that, when I drive my car, I turn up. And a shotgun is that's the one riding next to the driver.
Yes, true.
And I think now this is also about collaboration. So they are both important. They have different roles, but it's a really nice song. So try to listen to that.
The Shotgun, and the artist is?
Josh Ezra.
Josh Ezra.
And the other song, that's a very personal song, is the song, it's Perfect by Ed Sheeran. So I met my husband when I was very young, and we got married very young. And when we had our 25th anniversary for our marriage, he made a speak using this song, and it's about learning each other to know when you were young and growing old together. And
oh, that's nice.
Yeah,
that's nice.
And the last thing you ask about is, what do we want to take to a desert island? But I don't want to be on a desert island. I don't want to be on my own. So what I want, if I should bring something there, I do running on Tyring in the forest with a map and a compass. So I will bring my compass so I can set the direction to escape from the right way from the island, to be together with other people.
Nice. Running in forests with a map and a compass.
Yes.
Yeah, I remember that from Boy Scouts orienteering.
It's not just Scout, it's a professional...
oh, I'm sorry, I didn't... that was just my experience, but it was very much fun. I love doing that.
And you can do that all over the world, because if you just are able to read a map, you can do it everywhere.
Sure, of course.
Yeah.
Jeanette, thank you very much. This has been very informative. Thank you for providing the nurse's perspective. A lot of wise and great messages in there. And thank you for doing what you do.
Thank you.